it's Dr. Achina Stein interviewing Dr. Keira Barr today. She's a dual board certified dermatologist helping women navigate symptoms of menopause naturally. So Dr. Barr turns conventional methodologies on their heads so midlife women can feel comfortable in their bodies and love the skin they're in. She creates a bridge between hormones, skin, and mind-body medicine to optimize women's midlife experience and is a fierce patient advocate. Dr. Barr empowers women worldwide to take control of their health and their hormones in menopause. She's an international speaker, best-selling author, clinical educator, and considered a leading author on women's health. As a former assistant clinical professor at UC Davis in the departments of dermatology and pathology, editorial reviewer of multiple leading medical journals, medical advisors within the personal care and tech communities, and researcher in clinical trials, Dr. Barr is dedicated to providing the most cutting-edge and innovative solutions for women. Her work has been featured in MindBodyGreen, Better Homes and Gardens, Reader's Digest, Glamour, Self, Oprah Magazine, and more. So I want you to welcome Dr. Barr to the podcast. And welcome. And I'm so glad you're here because we do have lots of patients who do join us from time to time to view and ask questions at the end, if time permits, about skin, about menopause and perimenopause and how that can affect your skin as well as your mood. So I would love to hear first from you about how you got to this place in your career from a dermatologist doing functional medicine and working with people and their hormones.
Yeah, it's a great question. Thank you so much. And listening to the bio, I'm like, all that means is I've been doing this for a while. I'm older.
I know.
I like dates how long I've been in medicine, right? But that's okay. So, it's so interesting because it's really only in the last few years, and it was because of my own health challenges that I connected the dots of how I even wound up in dermatology in the first place. And it really stems back to my childhood. So when I was a kid, I was born with 2 birthmarks, one on each side of my face. And when I was a kid, initially, I didn't think anything of them. They were my beauty marks. But when I went to school, kids immediately pointed them out and called them coffee stains. Huh. And it was the first time that I, realized my skin could be a source of shame and embarrassment and humiliation. And so I quickly discovered that if I got a tan, I could mask those marks. The problem was my dad's a redhead, even though I'm a brunette. I burn. I was never meant to fry myself in the sun. Fast forward, lots of moles, lots of freckles. I become a dermatologist. I specialize in skin cancer and melanoma, and I have to diagnose myself with melanoma.
Wow.
And that was kind of this wake-up call. And it was simultaneously at a point in my career where I wasn't necessarily as happy as an academic medicine, not able to practice in the way that I want to. I was running ultra marathons and thinking, to look a certain way, to have my body a certain way, literally ran myself into the ground. And it was this storm of stress, emotional, the physical stress, that led to this diagnosis. And at the same time, I was having migraines and bloating and anxiety, all the things.
That's a storm.
And it became really clear that I needed to do things differently. I needed a different approach. My doctors were just throwing pills at me. So that led me to searching out alternative ways like integrative and functional medicine. And because of the challenges I was having with migraines and bloating and changes in my menstrual cycle, my gynecologist, no one talked to me about menopause or perimenopause. So it was the impact of stress. It was the change in my life because I was in my mid to late 30s at that point. And unfortunately, I had to the options were oral contraception, intrauterine contraception, or surgery.
Mm-hmm.
And I wound up having surgery.
And how
And I
old
just
were
thought,
you?
at that point, I was 42. So I had a hysterectomy at 42,
Wow.
which I realized I've learned was not necessary. And I thought, if I, as a physician, had no clue how to help myself, and my doctors did not broach the topic with me, how is the average woman supposed to understand what her choices are, what her options are, how she can take control of her health?
Wow.
And so that really led me to this path now of treating women in menopause, supporting them, mind, body, soul, diet, lifestyle, and hormones, so that they can really thrive at this time of life. And the connection with skin is that so many of the changes that happen as our hormones diminish, your skin is the first place you will see it. It's a window to and reflection of your overall health and well-being. So for me, it's this beautiful marriage of like, I can use the skin as this great roadmap to help understand what's happening inside the body, and then help women from the inside out.
Right. Yeah, the skin is the second largest organ for detoxification after the liver. So yeah, it's absolutely a great way to know what's happening in the body by looking at what's happening in the skin.
Yeah. I think a lot of people, women in particular, and by no fault of their own, because of cultural norms and societal pressures and marketing for the $500 billion beauty industry, that we're told there's something wrong with your skin. You need to cover it up. You need to wear makeup. You need to do all these things. That many women see their skin through a lens of criticism and comparison, and they have contempt for what they see because they think it shouldn't be there.
Mm-hmm.
And for me, I really invite women, especially, to view their skin from a different lens, that your skin is not trying to sabotage you. It's not trying to ruin your day. It's giving you information that you can use to give yourself the love and attention that it needs, so that you can thrive. Your skin will glow. So
Right. Yeah. So can you tell us a little bit about your approach and what kinds of skin conditions lead you to think in one direction or another?
yeah, especially, now that the focus of my practice is women in perimenopause and menopause, some of the biggest complaints that they'll have are hair thinning, dry skin. Some women will have hair growth on their face, but they're like, hairs on my chin, but thinning hair on my head or my pubic area, and maybe acne. And so there's so many different conditions in dermatology that we could dive into, but those are some of the most common.
Mm-hmm.
And I think, it gives me information in terms of where to look, right? It's not just one hormone, right? Our hormones work in a beautiful balance together. And especially with hair,
Mm-hmm.
our hair grows in 3 different phases: a growing phase, a resting phase, a falling out phase. Estrogen plays a role in prolonging that growth phase. And so when estrogen declines, there may be decreased opportunities for the hair growth, and it may shift into some of these falling out, resting and falling out phase. But we know that thyroid plays a role in hair growth. We know that actually progesterone plays a role in hair growth in terms of how it regulates our androgens.
Right.
So it's really this, it helps like peel back the layers of where do we need to look. And it's not just supplementing that with the bioidentical hormones. It's, is your body processing this? How is everything working together? So
Right.
it's a more comprehensive approach.
Absolutely. Yeah. I mean, just looking at the detoxification pathways and, helping your skin detox by looking at other parts of the body that help with detoxification will improve your skin, as well as looking at how hormones can be affected by stress. And so stress can cause significant hormonal changes, which can then affect your skin.
100%. And this is where it's fascinating. Mm-hmm. So when we think about stress, we always think of it from like a top down, like our brain. So the hypothalamic pituitary adrenal axis. So the brain sends signals ultimately to our adrenal glands, which then produce those stress hormones like cortisol, adrenaline, and noradrenaline, which trigger the inflammatory signaling, and all of that gets sent throughout your body, and including your skin, and it has downstream effects.
Mm-hmm.
What's been discovered recently is that our skin itself has its very own HPA axis. So those stress hormones can be produced locally, as can your sex hormones. Your skin has the capacity to generate the sex hormones within your skin. The problem is when we are stressed, when this HPA axis is activated, it basically prioritizes production of the stress hormones, and everything else takes a back seat, including production of the sex hormones. So in menopause, this is compounded because your body's naturally declining production of your estrogen and progesterone and testosterone. You add stress from any factor, whether it's perceived, real, environmental, physical, emotional, and your body's prioritizing the stress response, and it's shutting down essentially the production of the sex hormone. So it's kind of a double whammy as we get older, stress plus the natural aging process.
Right.
And you'll see it'll show up on your skin, accelerated fine lines and wrinkles, thinning hair, dry skin, vaginal dryness, all related.
Right. And stress will accelerate that once a person hits menopause or transitions through that. So it just accelerates that process.
It does accelerate that process. And that's where, having tools to help manage the stress, we can't get rid of the stress, right? We live in a world where we're constantly exposed to things, and nor do we want to get rid of all the stress. Sometimes acute stressors can be positive and motivating and keep us safe,
right?
So we can respond to it, but it's that chronic stress that really can wreak havoc.
Yeah, it's learning how to respond to it and develop an ability to be resilient. Knowing how to respond in a resilient fashion is going to be very important. So, but it is first being aware that there is stress, and at least the emotional, like you said, the perceived and the real. But the parts that most people may not make connections with is stress to the body, where the gut, if there's stress in the gut, or where it's foods, inflammation, infections, foods, infections, toxins that are coming from other places besides emotional toxins, and so it's looking at the whole picture and how they're all connected.
Like what you're putting on your skin matters, which is, key. And I don't think, the average woman is putting on anywhere from 12 to 16 products in a day. And if we're not looking at the labels, if we're not aware of how certain things can impact our body, it's just this cumulative effect. And it's not just the one thing, it's that plus, the packaging of our food. It's what's in our packaged food and the ingredients, and all of those things matter. And so that's the beautiful thing about our skin, is that I always like to say it can be your greatest cheerleader. When you're eating well, moving well, sleeping well, it will glow. It will advocate that you're living that, healthy lifestyle. But it can be a really crappy confidant. Like, it will tell all your secrets.
Right. Absolutely. Yeah. Absolutely. Yeah. It's like being able to read a person's expression. Yeah, absolutely. Yeah. So, before we started recording, I did ask you a question, and it would be great, I think, to just talk about it a little bit here, is about treatment, at least traditional treatment of skin problems. And I had wanted you to talk a little bit about Accutane and how, whether or not that can, I've been told, or I've been asked by some primary care providers to provide a letter stating that it's okay, not primary care, sorry, dermatologists asking for a letter from me stating that it's okay for my patient to use Accutane because they do have a history of depression and is on antidepressants. Can you speak a little bit about that? So, and what your knowledge is about that?
Yeah, and this is a great question. And, in full disclosure, currently I'm not treating anyone with Accutane because my demographic now is the menopausal set. But this is, everyone needs to be treated as an individual, first of all. There's no one blanket answer. And so I think we have to take everyone's individual scenario into account. And now that I have that lens of like a functional approach, it could be a very different story of what is contributing to their depressive symptoms. Are we missing something? So I would have a very different approach now than I did when many years ago.
Right.
Here's what I know.
Yeah. I do too. Very, very different. Yeah.
But here's what I know. Acne is one of the most prevalent conditions, skin conditions. It affects probably more than 85% of the population at any one time throughout their lifetime. And we also know that there are studies that highlight that it doesn't matter how clinically severe the acne is from the clinician standpoint. It's the individual's perception of what their acne means for them. So it can be mild in my opinion, but it's severe and it's having a significant impact on their quality of life. Mm-hmm. So acne definitely impacts mood, hands down. There's studies over and over again. And so that's really important because it's quality of life. Mm-hmm. When it comes to Accutane, my personal experience is that people's moods actually improved significantly over the course of their being on it. I don't think there's in terms of definitive literature of proving depression with Accutane. I could be wrong. I haven't looked at the literature in quite some time. But for the vast majority of all the patients that I treated, their mood improved over the course of those 5 months. They have dry skin, yes. Did they, was it itchy and irritated and they didn't like getting their blood tests and all the things that were a hassle? Yes. But when they could see that their skin was clearing, that there was progress, that they were healing, it was like amazing. My patients, I remember this one boy in particular, he had long hair when we started because he was trying to cover his face. And month by month, the hair got shorter. He started to look up to the point where he would make, at month 5, the course is usually about 5 months, looking me in the eye, laughing, like he was a different kid. And I always hold him in my mind of like the power that, yes, I would love to use diet, lifestyle, and more holistic, but there is that bridge where sometimes medication is exactly what you need for some people because their mood has become so down and their energy becomes depleted because of what they're experiencing on the surface of their skin.
Right. So you see that as a result of a response to the change in their skin. And so I wonder about the actual side effect of Accutane that can cause depression. So.
Yeah. And so because I haven't personally experienced that, so you just think about how does Accutane work? And it actually targets the retinoid receptor on the oil glands. Is there, could there be an interplay with other inflammatory cytokines and any, I'm just thinking of like the detox from a functional standpoint, is there detoxification issues? Are there things that we could do in conjunction with people who are taking Accutane? That, in terms of other supplementation or omega-3 fatty acids, other things that can support brain health. But from my personal experience, I have not seen that correlation. And the vast majority of my colleagues, when we've had these conversations, their experience is the same, which is why you have probably been getting those requests. Like, we know that this helps people. We know when appropriate, we do not just throw Accutane at everybody. There is a certain subset of population that has failed other treatment. We do not take it lightly.
Right.
But there are certain situations where it makes sense.
Right. Yeah. I'm thinking about one patient in particular who actually has recently asked me for permission to use Accutane. And what's interesting is that she came to me for treatment of depression and anxiety, and her skin was actually pretty good. That wasn't a complaint for her. But in doing addressing root causes and cleaning up her diet and providing supplements, cleaning up her gut, et cetera, et cetera, she had a detox reaction in her skin. And I've tried everything to try to clear her skin. and so this is now, going to a dermatologist after all of this and asking for Accutane, or asking me, maybe this is what I need to do, is take Accutane. And so, so I think I might revisit that with her, given what you've just told me, because I haven't been able to help really get her. She's doing great in every other way. It's the only piece of it that's really what we've been working on, is her skin, as a result of doing the functional medicine approach to clear everything else up. Yeah.
That's so interesting. I know my brain, my wheels are spinning. I'm like, all right, why
did that happen? I know it's never happened with any of my patients like that. Yeah. So I'll be curious. I'm curious. I would love to have a further conversation with you offline about it, but about what I could try. But it's just interesting how the body responds to certain situations, and why it's now stuck there a little bit. And so trying to get around that, I've been really racking my brain. So it's actually one of the reasons why I wanted you to come on, is just to even talk a little bit about skin even having almost like a detoxification reaction to other things that are going on in the body, and what to do about that. So, yeah. I see your wheels turning. I can see it.
Like, when I was primary derm, like, we wouldn't have thought about any of this stuff.
Mm-hmm.
And you treat from the top down, from the surface. Even if we were using some systemic drugs, we were looking for the results on the surface. And it just makes me think, okay, what's missing? Like, what are we missing there?
Right.
What other imbalances might there be? So,
yeah,
because we know that our skin can affect our mood, and our mood can affect our skin, right? Because we've got HPA axis from the brain down, and our skin has its very own. But lots of things can affect the integrity of the skin barrier. And this is where, like, what stage of life is she in? Mm-hmm. This is where,
she's a college student, dancer, very happy, no anxiety, no depression. Yeah, she's doing really well, except that. So, yeah. I have also a lot of patients who come to me with a multitude of problems, but it seems like psoriasis is also a major problem for a lot of people. Yeah.
And, it's so interesting because, psoriasis, is an autoimmune condition, and what we have found, I'm not a psoriasis expert. My focus had always been skin cancer, melanoma. But there's more and more evidence in terms of looking at that gut-skin connection. Mm-hmm. One of my colleagues, unfortunately, he has passed on recently, but he wrote a beautiful paper about really looking at doing an elimination diet, looking at the health of the gallbladder, bile salts, and phytonutrients and flavonoids to help patients with psoriasis. And so the impact that lifestyle and diet has on psoriasis is significant. What's really also telling is in terms of the stress component. So psoriasis is a condition where there are many comorbidities. Like, there's people who have psoriasis also may have diabetes, hypertension, depression. And it's always a question, is it the chicken or the egg? Which is it? But we know that inflammation is at the root cause of most chronic diseases. So inflammation in one organ is going to potentially create inflammation throughout the body. So really addressing root causes of inflammation is key. But what's really interesting is when they looked at stress as an inflammatory trigger, right? Because we know that cortisol can stimulate many of your inflammatory markers and directly affect your immune cell function. Especially if you've noticed people who have eczema or itchy skin, the stress hormones and their that pathway can directly impact the mast cells, which release histamine, which causes the itch.
Right.
And so what was really interesting is they did a study with mindfulness. So individuals with psoriasis we use light therapy. So even though we say the sun can be dangerous, when we harness it in a very medically controlled way for just a few seconds or a few minutes, called phototherapy, it's been really helpful because the sun causes immunosuppression. It suppresses the immune system. And so we use that to our advantage for certain skin conditions. So they did a study, this was back in the 90s, they did a study where individuals with psoriasis got the light therapy, and then they got light therapy plus guided meditation. And what they found is that the individuals who received the light therapy plus the audio tapes of guided meditation not only had greater skin clearing, but when they were asked about their quality of life and they did an assessment, they felt that their quality of life had improved in a significant way. And the studies like this have been repeated. There was a more recent study that looked not only at psoriasis, but alopecia, vitiligo, acne, eczema, a lot of conditions that are very prominent visibly and can create a lot of skin shame. And what they found, not only did they have greater clearing on their condition, but their level of social anxiety went down, their skin shame went down, and they also felt they had an improved quality of life by practicing mindfulness. So really directly addressing the emotional stressor.
Wow. That's amazing. That's really, really great. I'm really happy to hear about that. Yeah. So I don't think people realize just how much meditation can do more than just, people associate meditation with just calming the mind. And they don't realize that it really affects a physiological shift in your whole body, not just your mind. And I almost look at it as it turns off the alarms that are going off in your whole body, that there's danger or there's something wrong, or it helps to bring the body back into homeostasis, back into rhythm, a natural rhythm, and resetting everything. Yeah.
I completely agree. And I think, we underestimate the power it can have on our appearance, right? These studies have proven it. But the skin cortisol, which is the primary stress hormone, has so many impacts on skin health, breaking down the collagen and the elastin. So increasing, if I can appeal to your vanity, fine lines and wrinkles, you want to turn back the clock, you want that anti-aging remedy. It doesn't come in a serum, in a bottle, in a procedure. It comes from pushing pause and really taking time for yourself and asking yourself, what do I need right now? Right. And it's to take some time for myself and just breathe so I can decrease this response that is setting off the alarm bells and that's wreaking havoc with my skin. It impacts the skin barrier function. So number one, it increases inflammation, which can worsen your eczema, your psoriasis, your acne. But it also has a direct impact on the skin barrier integrity. So our skin is our biggest organ and our barrier from the external environment. And when that integrity is compromised, that's when you're more vulnerable to itch, irritation, and redness. You're more vulnerable to skin infection, delayed wound healing. All of this has been shown in studies how stress directly can impact your skin.
Wow. Yeah. So we talked a lot about stress and skin. I'm hoping that people who are viewing this video, that really hits home for them and maybe redouble their efforts in really using meditation. But one thing we haven't really talked about is food. What foods are maybe the top 5 foods that you see as directly associated with skin conditions?
Well, the negatively impacting skin, when I was in training, they always said there's no correlation with food. Dairy is not a problem, but we do know dairy, especially for some people, not everybody, but some people are sensitive, and part of that is if you're using conventional dairy with any potential antibiotics and hormones in it. We know that dairy can contribute to inflammation. It turns on your oil glands. So for people with acne, this is one of the biggest things for adolescents, for adults who are struggling with acne. I always suggest do an elimination of dairy because it increases something called IGF-1, which can directly stimulate those oil glands. It also can make the keratinocytes, the skin cells in the hair follicles, a little bit more sticky and turn on inflammation, which are 3 of the big contributors to acne. So dairy is one. Gluten is another. And this is where you had mentioned psoriasis. And this is what has been found as a correlation. People who eliminated gluten from their diet had greater improvement of their psoriasis. So I think doing a trial elimination of gluten is important. The third biggest one, hands down, is sugar. And, sugar creates issues with insulin and insulin resistance, which, let's talk about weight gain and inflammation, all the other things, especially in midlife.
Right. Exactly.
Hormones.
Yeah.
But the role that sugar plays in the skin in particular is sugar is involved in a process called glycation in the body as it metabolizes the sugars, and something is created called an accelerated glycation end product. So sugar contributes to the formation of these accelerated glycation end products. These will age you, right? Because they bind to the collagen and elastin and make them more inelastic. They make them more stiff and more fragile. And then the collagen and elastin fibers break down. And so that is what's contributing to the skin sag, the jowling, the fine lines, and the wrinkles. So those are the top 3 that can create challenges for your skin. And then we know that in terms of what can help boost the health of your skin are the healthy fats, like your omega-3 fatty acids, your wild caught Alaskan salmon. We know that, our skin, it has its own lipid. It's made up of fats and the glue that holds it together. So we want to see these healthy fats because they can have an anti-inflammatory effect on the skin. And your phytonutrients, right? So all the fruits, the benefits that are in the fruits and the veggies, and even spices. For me, it's always been for skin cancer prevention. I mean, skin cancer is the number 1 most prevalent cancer in the United States and in other countries around the world. And most people don't appreciate it because they're like, oh, and you cut it out and you forget about it. But you are exposed to the sun every day. Even when you're indoors, if you're sitting in front of a window, you're still getting sun exposure. And 90% of visible signs of aging are from the sun. So eating for sun protection, especially as we age, for us midlife ladies, this is really key. And so foods like, even beverages, coffee and green tea have been shown over and over again to have benefit for the skin. The EGCG in the green tea, the caffeine in coffee actually has been shown to be beneficial. There were studies that were done looking at skin cancer prevention, including melanoma, by drinking coffee. But it's also even if you drink decaf, it's how they process the coffee because it creates vitamin B3 niacinamide, which has anti-inflammatory effects. So, I mean, I could go on, but I would say don't have your coffee. You don't have to. In March, you have to know how caffeine affects you because that could trigger your stress response. We don't want to, have a benefit being washed out by a negative and jacking up that cortisol. But I would say green tea, black coffee, ginger is a good one. Your omega-3 fatty acids, your fatty fishes, and then really look at mixing the sugar, the dairy, and the gluten.
Right. Yeah. Well, the initial diet that I give to my patients when they first start with me, I mean, diets evolve as you work through the program, but it's a modified paleo diet, but gluten, dairy, and sugar-free right off the bat, because it resolves a lot of sources of inflammation throughout the body, not just the skin. So I'm really glad that you actually mentioned, and I didn't even prompt you. You just said it right there. You go. It's like, see, everybody, it's functional medicine that can really bring your whole body back into balance. Instead of seeing all these different providers, for different organs, you can actually do the same approach, lifestyle and dietary changes, to improve your every single organ in your body, not just one at a time. So
I like that. And I think, in some ways it's like we label it as functional medicine because, right, optimizing the function of your body, but it's really the foundational medicine.
right.
It's foundational. And then if there are some nuances, like, you're one patient who may have skin issues, maybe then she does need a subspecialist to really help dial in certain things. But I think we all would benefit significantly by incorporating and adopting some of these foundational functional principles in our lives.
Yes. I had a patient say it's common sense medicine.
But it's not. Common sense is not so common, especially when we're trained in traditional medicine. I think what's nice now is that there are a lot of integrative medicine programs, and they're incorporating things into curriculum, which, being an older physician, I did not that in my training, but it's not so common if you haven't been exposed to it. So I think having these kind of conversations where we can hopefully make it more common.
Yes. Yeah. Well, but it's common sense as opposed to common. Yeah.
I didn't even know. Like, I thought I was eating healthy because the trend at the time was low fat,
Right.
it was low sugar. So I was drinking diet soda,
Oh my
and
God.
I was eating cereal.
Right.
Well, hello, that's sugar in my cereal. And processed chemicals. I didn't know to read my labels. I was never taught to read my labels.
Right. None of us were.
Right. So now that's maybe common sense, but it wasn't on my radar. Now,
Right.
so I think it's,
Yes.
yeah,
Right.
simple
Yeah.
thing. It doesn't have to be complicated.
Yeah. Well, when people want to know the answers to their questions about why things are happening, traditionally, most doctors don't really know how to answer those questions, and they just kind of gloss over it, and then kind of, just sort of approach it with suppressing the symptoms as opposed to really figuring out why and how it's all connected. Sort of being the Sherlock Holmes of figuring out, how do we connect the dots, and how do we get to the bottom of what's causing your symptoms, and bringing the body back into homeostasis so that you don't need to be on medications for the rest of your life, unless it's absolutely necessary. Obviously, there's always going to be some situation where you do need to be on medications for whatever reason long term. But, I think it's overall, you're going to have longevity and age more healthily if you can bring the body back into balance and get to those root causes. Yeah.
Yeah. Agreed.
Yeah. So I know that you have something to share with our my audience, my patient population. There's a download that I will include in the show notes. And is there something that do you want to say something about that? What you were? I think it's.
Well, we were talking about skin. We were talking about food, and so this is a guide to help you with glowing skin. So it's the foods to include. So, kind of tapping into how to nourish your skin from the inside out, starting with food. So kind of just to make it easy and reiterate some of the things that we were talking about today.
Yeah, that's great. And so can you also let people know what the name of your practice is, and how, if they wanted to contact you, what would be the best way to contact?
Yeah. So the name of my practice is, we were talking about resilience. So it is the Resilient Health Institute, and my website is drkeirabarr.com. And so although in terms of prescribing hormones, I'm limited to the states that I'm in, I do support women all over to help them get back in balance, to help them, navigate their path through midlife. And so my website is probably the best way to get in touch with me.
Okay, great. Are you seeing patients in person or online? Are you doing consultations?
I'm all online. I am online. So it's, it was even before COVID hit, but it's been amazing from the comfort of our homes that we can connect and support. And so this may be similar for you, as long as women have a primary care physician locally who can, do the appropriate examinations, we can do everything online.
That's great. And where are you actually physically located?
I am physically in the greater Seattle area.
Oh, great.
We're like clear across the country. I'm an East Coaster, born on the East Coast, and now I'm on the West
On the
Coast.
West
So it's my
Coast.
new coast, but the East Coast definitely has a part.
Yeah, actually, it was going to be going to Seattle about a year ago, but to a conference. I forget which one that was in Seattle, and I unfortunately had to cancel that because of COVID. So someday I will be there visiting you.
That'd be great. And I would suggest if you can time that conference between July and like October, because that's when our weather is the best. So
Okay, great, great.
fall in love with Seattle. It is the most beautiful place, but especially if the sun is shining. So July through October.
Okay, okay, great. So thank you so much, Dr. Keira. And I think this was a great talk about all sorts of things related to skin. I really appreciate your time today and informing my audience about your approach to skin and how it connects to depression. And I wish you luck. Thank
Thank
you.
you so much. Such a
Okay.
pleasure.
All right.